My name is Dr. Robert Accettola. I've been a cardiologist here for 30 years. I've known Mark, met him in 2003 when he came to Norfolk General, and I've known him since that time. We've worked together for almost all of that time. A brief aside, my family was in medicine, and I have a strong feeling about how doctors need to practice to do the best for the patients. They need to have a really strong knowledge base. They have to have good training. They have to keep up to date. And they have to be intelligent. Mark checks all those boxes in spades. But what he adds that most people need, and I don't see as much of nowadays, is that he gets to know his patients well. They know him. It's a long-term relationship, not just I'll see you for 2 days and then I'm gone to the next assignment. I don't think that works well. Mark knows his patients because he sees them. He's the only physician in this practice, pretty much. And that knowledge of the patient helps tremendously in sorting out complex problems and help the patient and family become confident that he's working hard for them. He will find an answer. None of us know everything, and none of us have all the answers right away. But as you keep working with the patient, you will often come up with answers that you wouldn't have gotten in a short time. Sometimes you can get the answer quickly, but most times it takes more time. There's more nuance to it. And having the kind of practice that Mark has, where he spends the time with the patient, he sees them over a long period of time, is a longitudinal element that is, in my opinion, very important. Then, of course, there's the man himself. He has high integrity. His practice is not a job. This is how he serves. And the combination of all those things we discussed a second ago that doctors need to have, plus the integrity and the dedication and the care, the individual care for the person. It's not a patient, it's a person. And his care for that patient, for that person, is so important. And I think that's what people need to know, so that the people who need to be here seeing Mark can know him and find him, and then he can help them along the way to better health. Would I recommend Mark? Not only would I, but I do. I've retired recently, but a lot of the patients call me and say, who should I go see? And Mark is one of the several that I recommend. But they also know him because for the last many years, he and I have been covering each other along with 3 other friends. You don't have somebody cover you unless you trust them. You know that they're going to treat your patients the way that you hope they will be treated. And he's always done that. So a lot of my patients already knew him from his seeing them on weekends and at nights. But apart from that, even if that weren't the case, I would highly recommend him to my own family or any patient that needs referral to another cardiologist. They couldn't be in better hands. One of the things that all doctors and cardiologists need to do is know when they're not sure what the issue is and they need help from somebody else. Mark has never been shy about asking for help from other people if he feels like that's in the patient's best interest. And so there's absolutely no equivocation when I say I would highly recommend him to any patient, any family, including my own family.